Hello everyone, welcome to another episode of Dental Digest with the Study Boards. I'm Dr. Trehan and today we are diving into an essential topic in oral pathology, odontogenic tumors, cementoblastoma. Now we are going to take a very comprehensive approach in understanding cementoblastoma. We are going to start with its origin and etiology, then explore the pathogenesis and clinical features. From there we will examine the radiographical features and histopathological characteristics. We'll also discuss potential complications, treatment strategies, and finally important differential diagnosis to keep in mind. So let's break it down step by step. Let's talk about origin and etiology. Now cementoblastoma is a benign tumor of odontogenic origin and it is classified by WHO as a true cemental neoplasm. It is one of the only tumors derived from cementum and it arises from ectomesenchyme, which is a mesenchymal tissue responsible for forming cementum. Now this is relatively uncommon tumor that predominantly affects young men under the age of 25 and its male to female predilection ratio is 2:1. Now let's talk about pathogenesis. Now cementoblastoma results from uncontrolled division of cementoblasts. And this leads to a dense mass of cementum-like tissue that replaces the tooth's root. Then the tumor grows and becomes intimately fused with the affected tooth root. And this is what causes root resorption and sometimes even tooth displacement. Now in advanced stages, it can expand into the surrounding bone as well, potentially causing jaw expansion and cortical perforation. Now despite its benign nature, the growth pattern demonstrates aggressive potential if it is left untreated. Now let's discuss the clinical features. Now cementoblastomas are usually asymptomatic and they are discovered incidentally on routine radiographs. And whenever the symptoms occur, the patients may report some pain, localized swelling of the jaw, or even jaw expansion. Now the tumor commonly associates with mandibular molars, particularly the first molar. Now a very important feature to remember is that the associated tooth is typically going to be vital unless any secondary infection has happened and caused extensive root resorption alongside. Now let's talk about radiographical features. Now cementoblastoma, it appears as a well circumscribed radiopaque mass surrounded by a thin radiolucent rim and it signifies active growth. Now the tumor is characteristically fused to the vital tooth's root and this root fusion is a hallmark feature distinguishing cementoblastoma from other radiopaque lesions. Now let's talk about the histopathology. Now microscopically, cementoblastoma consists of cementum-like tissue with prominent reversal lines that are areas of alternating bone resorption and deposition. Now multinucleated osteoclast-like giant cells are scattered throughout the lesion alongside plump cementoblasts within the fibrovascular stroma. Now small trabeculae within the lesion are lined by osteoblasts. Now the tumor's periphery resembles a connective tissue capsule that helps delineate it from the surrounding normal tissues. And this combination of features is distinctive and helps differentiate cementoblastoma from other odontogenic tumors. Now let's talk about the complications. Now although this lesion is benign, cementoblastoma exhibits locally aggressive behavior. Now, root resorption occurs as the tumor fuses with and breaks down the tooth's root. And the tooth displacement that we talked about, it results from the tumor's growth that is exerting pressure on the adjacent teeth, potentially affecting the occlusion of the patient. Now, the jaw expansion and cortical perforation can also occur in advanced or recurrent cases, leading to a visible swelling and some deformities in the patients as well. Now let's talk about the treatment options that we have. Now the treatment of choice is going to be complete surgical excision with extraction of the associated tooth as the tumor is closely attached to the tooth's root. Now for localized lesions, curettage or peripheral ostectomy may be used to remove the residual tumor tissue. Now why exactly are we doing the curettage? Curettage is scraping out the tumor while the ostectomy component, it removes the affected bone. Now complete removal of the tissue is essential to prevent any recurrence. Now let's talk about differential diagnosis. Now several conditions can actually mimic cementoblastoma. Let's start with condensing osteitis, which is a reactive bone formation from chronic low-grade infection, but it lacks cementoblastoma's distinct radiopaque mass and radiolucent rim. Now think about osteoblastoma, which is larger and it presents with more aggressive features and typically affects long bones outside of the jaw. odontomas, which are usually multilocular and lack root attachment. Then think about periapical cemental dysplasia, which is a self-limiting condition without tumor to root attachment or bone expansion. Think about hypercementosis, which involves excess cementum on the roots but lacks a distinctive radiopaque mass and radiolucent halo characteristic of cementoblastoma. Now let's talk about the key points. Now, cementoblastoma is a rare, benign, true cemental neoplasm arising from ectomesenchyme. It is affecting young men under the age of 25 and predominantly present in the mandibular molars. Then we talked about how it results from uncontrolled cementoblast division, creating a cementum-like tissue that replaces the tooth's roots. Then we talked about some clinical features, radiographical features, we discussed the histopathology, and then finally we discussed some complications, treatment options that we have, and in the end we discussed the differential diagnosis in depth. Now, thank you for joining me on this episode of Dental Digest with the Study Boards. If you enjoyed this breakdown, please like this video and share it with your friends and subscribe to our channel for more content. We are here to support you every step of the way. Keep up the great work and I'll see you with the next discussion very soon. Until next time, keep studying hard and stay motivated.